Hey guys, it's Dr. James Kennedy's Texas Foot and Ankle Centers. I actually have a patient here with a problem, and her problem is she has what we call posterior tibial tendon dysfunction. And what it is, it's when the posterior tibial tendon inserts into this bone. Okay, how that's usually diagnosed is when a person is standing up. Okay, and when this person is standing up for her. Okay, I'll demonstrate it for her. On her left foot, when she tippy toes up just like this, okay, she doesn't have a problem. But on her right, she could just barely do this. And when you're trying to do this test, don't be a hero. If you can't do it, you can't do it. Okay, but this right here, she couldn't stand up, okay, on her posterior tibial tendon. Okay, and so what it is, it's the tendon right here going behind the tibial bone and inserting right into this area. So if you want to look at it, I love this foot model because it actually shows a foot skin down. And the posterior tibial tendon muscle belly is right here, right behind the tibia. It actually comes out right here, right behind the medial malleolus, and then inserts right in this area, okay? So you can see when you plantar flex right in here, okay, if it's inflamed, there is no way that she can actually raise her heel, okay? So, you know, I like to give a lot of Medrol dose packs. I think they work for small cortisone inflammation, things like that. But I'm going to show you all today how to do stretching exercises, either with a TheraBand or a simple rope. I got this rope at Home Depot. You can buy them anywhere. You can use jump rope, whatever, or you can use different grades of TheraBand. So what I like to do, and I can show you with the rope here, and what you need to do, you need to grab it like a pair of horse's reins, just like this, okay? And I like to put this right along the metatarsal. You can grab it just like that, okay? And then I'll put it right here, okay? And you can use it with a shoe, okay? You shouldn't have a death grip on it, but it should have some decent amount of traction. You know, you can wear it with socks or put on a shoe, but what you're trying to do, and if you pull over here to look at this area right here should be stretched quite a bit. And what I like to do, I like to pull for about 2 minutes this way, okay, what I call laterally, okay, and then I'd like to pull 2 minutes just like this, just straight line with the leg, and then I also like to pull medial like that. So same way with the TheraBand. So what you would do right in here, and sometimes TheraBand is easy, it doesn't put as much pressure on the foot, but right in here, or you can get a friend to do this. You can start pulling, and then you start pulling laterally. That should get a good stretch. Again, you shouldn't put a death grip on this. The point is not to kill yourself on this. It's to get a decent amount of stretch going on right here. Don't be jerking back and forth. Just a good solid stretch for about 2 minutes, just like this. A good solid stretch like this, and then a good solid stretch like this. And if you had a friend, they could come around, and if you come around like this, you know, stretch it out just like that. And she doesn't even have to pull on it. She can just let go, and I can just go like this for 2 minutes. Go like this. And you really probably want to get a pretty decent stretch, because this is where the area that you're really trying to stretch out. But if you did that 3 times a day, 2 minutes lateral, 2 minutes medial, 2 minutes lateral, 2 minutes what we call straight with the leg, and then if we do it right in here, it should really help, and do that 3 times a day. That should get her back on track, but for some reason people just damage that. People that are very active, working out, a lot of joggers, runners do that, but that's something that's very, very simple that you can do at home that can get rid of posterior tibial tendon dysfunction. Very rarely do I have to go in there and do what we call a Kidner procedure, actually shave out some of that bone area, but believe it or not, if she did this for around 2 or 3 weeks, most likely she'd heal up with a little Medrol dose pack. Thanks for watching, guys. Bye-bye.